Hallelujah. Amen. Sisi ami hu se menka twi ana se menka brofo a menfa mfrafra. Amen. Tamara, Salom, congratulations. I didn't know you were the president of YAF. Wow. Mcsaint so ono no ba introduce me Mastresa. And it's so beautiful coming back to see very familiar faces. Ama me akai time a me wa ha no. Me kai time a ye wo JY. Ni e kwakwacho BC. Brad Dixon, ye JY leaders no omo organize classes maye. Ye be sia dia wa ha me kai nyina. I also remember when we even went for the Miss Malaika. I came back here with my family to come and thank God because the whole church even supported me. But on the whole, we want to say God has been faithful. Maybe area ni mwache. It's not me catch my colleague ne kra say, I say maybe had 10 years new. Maybe me who sa bansu yes, this is dying. Come. In yama san. We thank God for our lives, and I'm happy to see you all. And I feel very welcomed here. So I was there last week, and then Balfour gave me a call. That's YAF week, and they wanted to talk about health. So he wanted me to come. I don't even know how I said the yes, no, because usually in Kofutun Safram is make us check me itinerary and but no kind pe. Now me show patience crowd and I'm saying, yo, Mati, I'll call you in the evening. He took it as a yes. And a yes in the Diabesi Hano. Yeah, the radia say, first of all, I want to thank you all for even coming for the program because Mcsaint organize the program. Very late. But me jitu mu say nyame sesan na little by little. Amen. So I'm told say the title for tonight's talk is Importance of My Health. Importance of my health. Mekane say WHO classification or definition of health. Bebre na ye ka health a ya adwena ne say o miti ye me ya. Me yefunu ye me ya. Ana obi enya cancer. There be WHO are widening the scope of the definition of health. Or say health in yes say uni yare keke. It's way beyond that. It's a state of complete mental, physical, and social well-being. Chese wadrim no eda ho din hweni wa ha wadrin. U social life eda ho kama. Utumi nante comfortably wo krom, you are okay. And a physical wapom, you are feeling strong and all that. Once in what satisfy categories in our way, then we can say that you are healthy. Into your answer, Rebecca say you are healthy. It's not just say wuni yare, but oda utumida. Bibi wo wa ha wadwen. Bibi wo wa unya kai pen wa kuma start say born tem. If all these things are in your life, just say wa untiapo. Untiapo. Intende mi jina ha mi bisa say yemu ahe na ye share definition where yentiapo. If you fall into this category, just give me a way. Share definition where utiapo and asa wontiapo. It's about we say yentiapo. So that's the definition of health. So you'd realize that sometimes my testimony me de radia the whole year me call hospital. Yes, it's a testimony. Now so call hospital. Yeah, call hospital only when we are sick. Sometimes we call hospital call for checkup, which is a very important aspect of our health. Yeah, and taking into account or yeah, and taking into consideration. Into uni power ho how. But at least once a year, what sorry say me call hospital, me call check me kidney, me call check me liver function, me call check me thyroid, me call check me chest. Nyama weni na what ye nyama e was say ye even though we are not sick. So that's a BBS that ya read there. It take a long time and sana AC. And yes, we who symptom na just say enra. Oba hospital baby say dabena ya we start no aka say enra. But yeah, nim say ade when enra sem started years ago. But nanka ye fire annual checkup. Seriously, and I would have been picked up early. Nasa intervention be what near intervening. Amen. Sorry, I can't amen ni bebre because I am preaching. So. Intino, studies show say our countenance impacts a lot on our health or our well-being. So make a countenance how we feel, your facial expression, it all impacts on your health. Into sorry now we muna wenim and now obi wo ho a etete wonti hu nipa na wo buefu. Nyama weni na can affect your health. In India, it was shown say they use laughter therapy to help in the management of cancer. Inti as obienya cancer wo ba kolebu bet na wo beji chemotherapy in Yama. If you go to India, they have a laughter center. They use laughter to manage cancer. So that shows you how your countenance can affect your whole well-being. So they have instituted something we call National Laughter Day or World Laughter Day. Yes, and it used to be on the 5th of May. But you see, I'm almost celebrating it every first Sunday of May. So laughter actually impacts a lot on our health. So what sorry krana wo sresre. Wo sresre we niaje. Wo sresre. There's a certain hormone which is called serotonin that's released into the body. That helps in your general well-being. Now, so if you are stressed, you are anxious, other hormones like adrenaline, noradrenaline, cortisol, nyama weni nina are released into our body. Sometimes it can induce stress. Now when there's stress-induced ulcers. So generally, your countenance plays a vital role. So that's how come you can relate it to even unforgiveness. Obiya wadia na wuntumi fan chenu buefu, uhunu pena ubuefu no. Now you are just affecting your health. So these are certain things we should do. Usha ukotokom na ukotokom no pocketi ya. Just when your pocketitis cry. Wenim die, ubetimi ati wenim. Ubetimi asresre, o sresre no. Wa pomudeng, unya apomudeng. Even though your pocket is refusing to pocket well. All right. So generally, I've talked about the yearly screening or annual screening. It's a very important aspect of our lives where little things are picked up early so that interventions can be done. Also, when you talk about dental, going to see the dentist, obi wo ho se ne se ya ne yape ansa na oba ko hu dentist. And now we who se ne se ne barbe tu ansa na oba ko hu dentist. But WHO recommends say every 6 months, we should go and see the dentist. Yes, every 6 months. And then even eye checkups. Ideally, every year, go and see the ophthalmologist. Don't wait till you have a problem first. Many of the health conditions, when they start, you are able to intervene. But when we wait, you delay na advancing. If na uko hu doctor, na ise na waba hospital yentu mi nyeshe mao. Recently, I was talking to a patient I had diagnosing with acute myeloid leukemia. And let me say, cancer, as of now, we do not even know the cause of cancer. So many people are propagating all sorts of things. We say we use microwave radiations need to make cause cancer. Eating hot food from plastic foods to make cause cancer. So we do not know what the cause of cancer is. Recently, I even saw a post talking about unforgiveness, where you harbor a lot of issues in your heart. When you see people, then you begin to be agitated. Nina can actually predispose you to cancer. So you realize that health is very, very interconnected. The freer your life, the more healthy you are. It's not make any power where say, oh, acute myeloid leukemia, where I was here more chemotherapy. Now, some of the conditions, no chemotherapy alone, if I say 6 cycles. One cycle, which is every 3 weeks to 1 month. One cycle alone is like 20,000 Ghana cedis. Make a change panepe or say, doctor, I'm say because me maybe I'm a way war. But there are little things we can do to prevent us from getting to that stage. All right, so there are some basic conditions here I wanted to talk about. Common conditions, hypertension. Who can name another common condition? Conditions are any symptom. Oh, you're fine, no, you're better, no. Oh, Andra na mene de kasa o. Yesi anope obi in the fridge akonu minsio no water from oko. So such conditions are called the silent killers. and hypertension is number 1. One a bit number 2. But before that, let me say I acknowledge the presence of our fathers and mothers in our midst. Maybe I catch me say between the ages of 30 and 40. But maybe that's not me who say, hey, ebi mo me sure you're beyond 40. So I want to say thank you for coming. We appreciate your presence in our midst. Okay, me forget my question there. What was the question? The other silent killers we know, aside hypertension, we'll be able to mention another disease. Good. One again. What's it? You see? Thank you. Let me talk about this. So BP is the same as hypertension. One day patients be Mcsaint. And I say, oh, you be. Or say, oh, there be. And I may be saying, I say, oh, hypertension. Or say, there be. And I say, okay. Maybe some other say, there be. If you offer in draw, or say, I'm a fair draw, if I'm a BP draw. Now, I say, maybe oh, hypertension. Or say, I mean, if say hypertension and one BP. So, hypertension and one BP. BP is your blood pressure. And it's when our blood pressure rises. That's what we call hypertension. When we say, okay, hospital, now you check your vital. You're more reading, be reading a fraction. Just there's a number on top and a number below. Usually, we say 130, 80. And now 120, 80. Beep hypertension here, when the readings go higher than 140, just as sono, it's actually 140 or more over a 80 or more. And only hypertension. If you get a reading 140, 80 and above, the patch hypertension, no, we need to intervene. Now check 132, 65. That's okay. It's a normal one. Any reading from 100 to about 130, 135. Over any number from 60 to about 80, thereabouts, it's fine. Anything above that is hypertension. Usually during pregnancy, somebody may have a normal blood pressure, but blood pressure that's pregnancy-induced hypertension. So your vitals, BP it's a common thing we should be checking. So want to be investing in the BP machine, per pharmacy be a benwo. Check your 1 CD. At least once a week, check it. Or people have me by hospital last year. Maybe checking my BP fine. And then maybe you say 140, 90 minjindi. But BP can even change overnight. Okay, so aside BP, we'll mention the other silent killer. Yes. Diabetes. You better talking about diabetes, kakra. All right. Any other thing? Any other silent killer? Malaria don't have silent killer or your obvious killer. Because malaria or setting in pair, fever, what's I say? But the conditions where you can do symptom be I just have course for a long time. Last one, yes. Thank you. Pachamumbo mano. I say high cholesterol. So cholesterol cause you may not know. Infant for no more pay achiches no. That's a common cause of high cholesterol. All right. Me pacha say me corner or question you can pause me at any time. May address any at waso. Okay, hypertension. No, it's not every hypertension case. Crampo na you best say a man withdraw. We have something we call pre-hypertension. Just a wound drew 140, 90 in a year. But doctor who said, normal BP 120, 80, and now by a way do 135, 85. Now, so when we say wound drew 140, 90 in a year, but your doctor is a bit concerned. It's another year pre-hypertension. Just a one just share about it. One show who you will just move into hypertension. Now, the common causes of hypertension, usually, so when we say, we busiemu, obi or hypertension you should know that you are at risk. And we don't need many family members to have the disease before we say that you have a family history. So one person in the family cry with disease now, then you are at risk. In the same way, if I say obi breast cancer, and now any form of cancer, once you know that, but you should know that then you have a family history of that cancer. or you have a family history of cancer, in such a case, you mention it to your doctor and you go frequently to the hospital for checkups. So once you have a family history, it means your risk is higher. Let me put this also. Sometimes, more investing in the machine, so they're able to check their blood pressure at home. Nanso, omunye drew hospital, maybe omu check you fear it's normal. Ebi mutiminya 128, ebi munya 120/60. Nanso ko drew hospital. No who said nurse ashane white, and now doctor ashane white. Penny identity ahumane chichen and sape. Na BP nene nam 150/100. Ebi dear 170/97. Now so you catch such a patient, and say, oh doc, they be me BP are fine. So in medicine, we have something we call white coat hypertension. Just say any proper hypertension, but who say doctor check you BP pe. Ebi mo the machine sound cry no BP ne costo. In such a case, it will be good say, oh, anytime I walk hospital, be a foul machine ni diwechi. What I say? Foul machine di wechi say ye machine check you hospital ho na was soap and waka nurse ni say me patcho me machine ni wa ha bet me dia check near dia check. If it's giving us the same readings, then we know that your machine is okay. If there are different readings, then we'll be able to now re-titrate or recalibrate, because many people know sometimes your machine they cry yes I see you see a check into calibrations, not they have to be recalibrated. It's a bit more fear, more checking, more blood pressure, you're fine, but it's not really fine because the machine needs to be recalibrated. So it will be good to take it along with you when you are going to the hospital. Okay. So I want to talk about some of the risk factors for this silent killer. I want to talk about it because it's a common thing. First, Nanka Rebecca said, oh, yeah, mama, no money, papa, mo mwenyi, no munya BP. Sisi adi enyesa. Oba hospitals are very young people in their 30s. Bankers especially. It's me who says stress. Obu ahoye juma o bank. Okay, bankers especially. Bankers, who say very young people get hypertension. But you see a young person, 26, the BP was show. I don't know if targets near mom, deadlines near mom, and mom stress now. But stress is a common cause of hypertension. So when you see that, you need to ease off your pressures. It is a juma for you should think about it. So setting up your own business, you think about it because your health also matters. So some of the risk factors for hypertension, like I said, stress, old age, as you know, your risk for hypertension is also increasing. People may have normal BP readings, but only the BP has to say a cholesterol. That one you can't do much about it, but you can just try to modify your lifestyle. I'll talk about the lifestyle modification. Then excessive intake of sodium. Sodium ya nchene. Omudidi. When you marry and your wife cooks for you, what's in it? Nature men san cast what kind of in chini nim. Now what san petit in chini guso. As a woman manufacture salt or Adriana sono. Common, having to notice that udidi na nchinene dos wo ma ema wo num nsuo bebre. How many have noticed that? Se nchinene dos wo aduane ma, you tend to drink a lot of water. In the same way udidi na nchini bebre wo ma, the body absorbs the sodium. Once it absorbs it into the blood vessel, it begins to absorb water from the cells, what we call the interstitium. It begins to draw water from it. Inside your vessel. Once the volume increases, the pressure also increases. So common cause of hypertension is increased salt intake. That's how come when you have BP, you will be advised that sometimes it's difficult to say that men didn't cry because idea why you used to for 30 years. Now all of a sudden you see Jaya adding. Until we start from somewhere, start reducing. Wow, improvements now. And then now we taste bad, so it starts to get readjusted. You begin to go off it. So common cause of hypertension is the sodium intake. Then also, I've talked about the family history. Then obesity. Say yeah, good living, sign of good living. Oh yeah, I say we live good, but not really. Not really. Once you are putting on a lot of weight or you are obese, the conditions are very connected. We're going to say you don't only have hypertension, you can end up with diabetes, you can end up with high cholesterol. So obesity is not a good thing. So what you should be doing, regular exercises. And you can't regular exercise, but maybe more now WHO who say exercise, you can say regular exercise, to understand the regular exercises. And so I'm going to break it down for you. At least every other day. You don't need to do it every day. The minimum, barest minimum you can do every other day. And commit 30 minutes to it. So, and then we have for 30 minutes, Ochna, you can skip. The next day, 30 minutes. The next day, you can skip. The following day, 30 minutes. So that's the regular exercise. Please, do we get it? How many of us will start doing regular exercises? And it doesn't matter whether you do it in the morning or in the evening. See, we are very busy, and even the stress alone impacts our health. So you would have to readjust your time. So we'll buy a juma late, like say 8 o'clock. We'll very early in the morning. We'll exercise. Now ebema why later. When you come back from home, we was skipping rope. Be with you. Was skipping with 30 minutes. If you feel to we are wakodare wakoda. The patriotic okay. And then sedentary lifestyle. Oh sorry, what's the baby fa movie. And once house helps Sophia. If you ko pensione mame. If me papa is an example. Remote need the hakra. Obetin is afano onfa obefre. But the little movements na ebwa. There's a condition we call deep vein thrombosis, DVT. Why not that? Good. DVT, the common cause, even though there are other causes, the common cause is when you are sedentary, you are immobile. Until your surgery, say now we done pemu for a long time, and you can end up with a clot in your leg. And the clot is because adequate blood supply is not going on, or adequate circulation is not going on. But when you get up and you walk a little, the movement is contracting the muscles. And once the muscles are contracting, blood is flowing. When you sit on the plane, say a 12-hour flight, you don't sit throughout the 12 hours. After every 3 hours, so sorry, now one nanse kakra. O nant na woman moja ne circulate ye. Esana unya clots wo name. Into the sedentary lifestyle can also lead to hypertension. And then stress, the famous stress I've talked about. Obi baby say na hypertension and the symptoms here then. And na meka say any symptom. Especially say started fresh first and symptom be any ho. Now so a course for a long time then you can begin to have certain symptoms. And who start saying who say akonechi. Usually the common symptoms you have. How many people can give us? Can just mention some symptoms? Yes. Severe headaches, pyro. Yes. Which other symptom aside the headache? I don't want to put people on the spot and see. But I know what I'm so yes, sir. Make you switch soon go from. When you so brew, dizziness, yes. What again? Numbness. Usually when you have the severe headaches and the dizziness, you want to mean dampo, yeah. You want to mean that. So sometimes, which we call insomnia. Sometimes numbness. Oh, when we say one sabako ajene, and now on 9 back. Sometimes I also be wo. As a pins and needles. These are all symptoms. Any other symptom? Pardon? Too much thinking. And too much thinking will be a cause. A cause of it, yes. A cause of it. All right. And usually, sometimes to me, then the pressures in the blood vessels can rupture. A bit me up high. It's who have been on the blood pressure cause 1 to 200. And we often see that. Sometimes almost 90 now check 200, 120. Now I say, oh, Ubi Pini was sure was here Joe to us and I said by management or Mcsaint. But that is very risky because at any point in time the blood vessels can just burst. Let me put it that way. That's what leads to stroke. That's what leads to stroke. So there are actually 2 types of stroke. We have the one that is due to very high blood pressure, which will make the vessel burst. Until we will trim the vessel, either the veins or the arteries, they burst. That is called a hemorrhagic stroke. Just a stroke away bleeding into your head. Then there's another type of stroke, which is an infarctive stroke. Infarctive. And no the vessel no empire. Now so plaques and how do I say plaques in chi? Nya maybe a clocky vessel no. Inti adia e was a BSA. Na mojane flow through no. Plaque bibia babe sheha. A chalking no bibia chalking into if I'm a quina ewo hon eswa into mojane into me flow freely if for the pressure and the flow into no infarctive stroke esana emma enough moja enko bibia into wo na if wa drain one side ne ewu because it's not having enough blood into na obe wo na we say one side weak one side weak. That's what we call the infarctive stroke. But soon, if you are supposed to choose one, the infarctive stroke is better than the hemorrhagic stroke. Even though both of them are not good. All right. So now how do we manage our life? Having the hypertension in mind or all these silent killers in mind. The main thing is just lifestyle modification. Lifestyle modification, and I've already talked about that. So the salt, so regular exercises, we've talked about that. Then your annual checkup. You see, who call annual checkup? Now call na doctor show, and then everything is fine. Don't think that you've wasted money. Do na ye dream home because sika weni na me test doctor because say shame me na me sika na ye waste there be waste here. Even the fact that you know say oh you're checking me kidneys are fine, you're checking me liver are fine, you're checking me lungs are fine, you're checking weni na are fine, that alone impacts your health. You know say you are strong, and it's a good reflection on your health. In the same way, we check up who say a problem be then we start giving medications or we start advising you concerning it. Then you begin to take the necessary steps. Into your annual checkup now. Let's not think say you waste sika there be. It's not a waste of money. Again, when you go for your checkup, not doctor ne kasa generally about your health. Then he can now advise you or now bring in other departments or other units to help in your whole health management. Example, doctor who say maybe your food is not balanced, or you do more of the oily foods. There's another dietitian's counseling will come in and guide you as to what to eat. Sometimes they can even direct you as to what oil to use. Into you check your cholesterol, you say cholesterol or high. We can advise say, oh yeah, Adriania, but more Adriana no, if I say bayre, who could bayre? Instead of going in for fried yam, who bet me a bayra yanwa, and now bayra yatuto. Who could di kokoni beans? Beans no, and who here pote say I was a watche. Who bet me atuto kokono, now we did, obibesi say enyede. The value is the same. But if you are thinking of your health, you begin to take the necessary steps. Sometimes the common question I get, oil ben na Adriane. Oil ben na Adriane. Yes, plant oil is better than animal oil. But in the plant oil, canola oil, very good. Canola is a plant. Canola oil is very good. Olive oil. Olive oil is equally good. Nanso, olive oil, it's when you read containers, church or olive oil was so. When we say, they tell you say it's cold compressed. Just say you don't heat olive oil. Into now the olive oil it's rather releasing harmful radicals. Do you get it? But olive oil is good for your salad dressing. And the oil dressing and the key to our good health is just moderation. Because it's difficult say when you for 30 years, 40 years, maybe potting jai. To remember moderation. Yes, when especially say uko buffet. Now when you say well, that's once a while. But adia unya no often. Please remember say moderation is key. Bibia kakra. Ebi muso timi bisa say na inkosia healthy and I say enye healthy. It's healthy. Now, you can't cholesterol. Cholesterol, you will move different types. You can cholesterol test. You bet your total cholesterol, your triglyceride, your HDL, high density lipoprotein, and your LDL. The HDL and the LDL, next time you can make sense out of it. HDL no a good cholesterol. Into cholesterol you bad. You have good cholesterol, you have bad cholesterol. HDL ni a good cholesterol. And LDL ni a bad cholesterol. Into say manage your cholesterol, the aim is to reduce the total cholesterol, but increase your good cholesterol, which is your HDL. Avocado pear is a good source of that. Avocado, pear, it's very good. It helps increase your HDL and it helps reduce your LDL. In cholesterol bad. We have good cholesterol. Our body cells are also made up of cholesterol. They need cholesterol to build the body cells too. Okay. Please, am I helping somebody? So, and stress. I mean, we need to. You know what your sources of stress are. Your source of stress may not be the source of stress of another person. Or you're okay, or you're okay. And you drew a I mean, that's not a healthy place for you. That's not a healthy place for you. And now, it's a source of stress. Try and let go of your stresses. Notice that where you're stressed, try to ignore them as much as possible and do things that will help release your stress. What are some of the things you can do to help ease off stress? When you are stressed, what are some of the things you do? Pardon? Oh, please feel free. What were you saying? Laughter. Yeah. Oh, that person should be your paddy. Be any another friend. Be any another friend. Serious issue. No, I mean, it's very healthy. Obi say what's issue name call but at that moment, at least you are laughing. And as much as possible, thinking too much does not add anything to your life. If you are thinking, what are you thinking about? Can you take a step? If you are thinking and the thought is to make you decide on a move to take, then please take the move. Stop thinking and take the move. But if you can't do anything about it, leave it. After all, what? Yeah. If you have that mindset, okay, so laughter, what again? Pardon? More rest. Good. Resting well. And WHO recommends that at least when we are sleeping, we should have at least 6 hours of rest. 8 hours of rest. At least 8 hours. Obi check it. Obi calculate. He said, "Me that time, me sorry that time, we should be at least 8 hours." Obi say if you don't sleep well during the day, your activities are affected. Okay, which other way? Yes.
You listen to good music.
Listening to good music. Great. Listening to music. Good music. And also exercise. Did you say exercise?
Okay. Sex also reduces stress.
Thank you. So, usually when one say oba na eka mbe man na your motai kan we na de mbe man na asama ye shy bi omuntimi ka oba na eka mamu. Yes, I mean sex is actually a form of exercise also. Yeah. It's a form of that's like when you finish you are panting, you are sweating. That's the essence of exercise. Good sex. Okay. So you want to say legalize sex. As the you are sex ayo. And no the stress that the stress that you will face, no. Cost 90. Yes, it should be legal sex. I mean, sex with your partner while worry. Ewe nijiemu. Not illegal. Adi awujani ayo real say e onye manata onye na efe wo drenje. Yes da. Thank you. Thank you. So generally, Daddy is saying that making efforts to drink a lot of water. Now, it is recommended. Sometimes, Uber Hospital, Rebecca just say, oh, drink a lot of water, drink a lot of water. Mumwahi nebisa say, a lot of water. How much is the lot of water? Who knows? Pardon?
7 cups.
Na cup. Maybe cup. Cup a wooden tea. Maybe we are broken into tea, just a tea cup. Maybe tea, maybe tea, maybe gagba or handle. Maybe media, no, 2 cups, 6 cups. It's a bit, well, it is 3 liters. 3 liters. Into sachet water, 500 mils. So 6 of that is 3 liters. That's at least. How many of us have drunk at least 3 liters of water today? Are you sure? One of them. We are sure. Wow, that's good. Why? How many of us? More than that. Good. It is very practical. You see, if your mind is on it, you are making a conscious effort to drink 3 liters of water every day, you will. So there are times I advise people 3 liters, but sometimes I don't. But when I have it in mind, sometimes you always have water by you. It's a way to remind you. Have water by your side all the time. You understand? And one way you can use to know that you are drinking a lot, if you go and urinate, and then your urine looks very yellow and concentrated, it's telling you that you're not drinking enough water. But when you drink a lot of water, about 3 liters, you see that now your urine is as clear as the water itself. When it's getting lighter, it tells you are well hydrated. So that's one key. If you want to know whether you are well hydrated or not, go and urinate. A yellow pant, yeah, no. And yet, but if it's clear, almost nearing water, that's it. Yes, what are the...
Can I ask something concerning the water? Do we have a way of drinking the water? Because as if some school of thought says that you don't just take the water and then everything, but you should be sipping bit by bit. Please.
All right. So the reason for saying you should be sipping bit by bit is because when you are asked to gulp it all down, it's with a lot of difficulty. Yes. If you're asked to drink 1 glass of water right now, if you're not thirsty, it will be a challenge. Yes. If I'm giving a bottle of water right now, but I'm not thirsty, and I'm supposed to drink the whole thing, the likelihood is lesser than Mcsaint kakra na masepe. By the end of this talk, if I had that in mind, by the end of this talk, I would have finished this bottle, sipping a little. But if it's given to me as a go to drink all right now, no. The likelihood of you drinking it is less. So there's no way to drink water. You just pace it well. So that's not like you are drinking 2 liters within 30 minutes. That's too much. Do you get it? The 3 liters is over 24 hours. So some people can wake up in the morning. The first thing they do, they drink 500 mils of water. Now they're left with just 2.5. Before breakfast, before breakfast, or 500 mils. Do you get it? There's no particular way. Just make sure that at the end of the day, at least you have drunk 3 liters of water. Let me add this caveat. If there's somebody with a kidney disease, renal disease, sometimes the kidney function is so low that the doctors are now limiting the amount of water you take. In that case, please, you run it by your doctor to know how much water to take. But if you don't have any limitations like that, please, the minimum 3 liters. Do you get it? So there's no way to drink water. Some people, it's easier for them even when the water is warmer with lemon in it. That's fine. Anything to help you drink. And it's not just water we are talking about. So fluids, one of them drink. And most coconut water, good. When you add all that, at least 3 liters should be fine. And coconut water is very good. Very healthy, has a lot of electrolytes in it. Very, very good. That's like when people come to the hospital, they have diarrhea, they are vomiting, they would have lost a lot of electrolytes. We encourage them to drink coconut water. So it's very good. Instead of going for Coke, malts and all that, you can do coconut water. Or you can do your natural fruits that you've blended into juice. Yes.
Too much of urine also gives a sickness.
Okay. So it isn't too much of urination, but when you are urinating too much, it's a sign. It can be a sign of a disease. I'll talk about that. So ideally, when you go to bed, you are not supposed to wake up more than 6 times to urinate, ideally. But when your sugar level is high, when you have diabetes, one way you can know is you waking up so many times to go and urinate. And that's what we call polyuria. You are urinating so much. So it's not the urination that is giving you the disease, but the urination is just a sign that you may have a certain disease. Now, but when you drink a lot of water, it's normal. Once you drink a lot of water, the kidney will begin to work more. So you begin to urinate more. Do you understand? But that's a normal thing. So when you are waking up more than 6 times at night to urinate, it's a sign. You need to report that. In that case, they will want to check your sugar to make sure that you don't have diabetes. Again, when you are, in fact, there are 3 P's in diabetes. Let me talk about diabetes a bit. So diabetes, which is also a silent killer. It's a condition where your sugar level is higher than normal. When you go to the hospital, you're going to check your sugar. They will tell you, have you eaten or you haven't eaten? What did you announce? Because we have the fasting blood sugar, then we have the random blood sugar. For the fasting blood sugar, any level from 4, any reading from 4 to about 6.4 is normal. You don't also want to let the sugar go so low because we have something we call hypoglycemia. That one can kill you instantly, even more than the high sugar. So that's how come people with diabetes, they would want to advise them, as you are taking your medication, eat also. Because if you don't eat, the medicine is going to draw all the sugar into your blood cells, and there will be less sugar in the circulation. That's what we call hypoglycemia. Any sugar reading less than 4, you can collapse. You can end up sweating a lot. You can be shaking all of a sudden. So such patients, we advise that you have sugar or Coke or anything sweet on the side. Once you see such symptoms, begin to take your sugar, rush to the hospital. Check your sugar, and then you rush to the hospital. Once it's less than 4, put something sweet in your mouth. And then any reading from this to about 7.4 for random blood sugar is normal. Anything higher than this reading is diabetes. Do you get it? Now, one of the features or some of the signs or symptoms of diabetes, that's what I was talking about, the 3 P's. We have polyuria. I've told you what polyuria is. What's polyuria? And you know that it's not that you are drinking too much also, but you are urinating a lot. That's a sign. Number 2 is polydipsia, meaning you are drinking a lot. And usually you will drink more than the 3 liters. You drink a lot, you are always thirsty. It's because your sugar level is high. Then the next P is polyphagia, meaning you are eating a lot. Sometimes you eat a lot, but you're not putting on weight. I don't know if Salom is like that, but you eat a lot, but you're not putting on weight. That's also, so these are the 3 P's. Drinking a lot, eating a lot, urinating a lot. When you notice that all of a sudden, and it's not like you are deliberately drinking a lot, you just can't control it. You need to take a step. Call hospital and check your sugar, then we can advise you along the line. Okay. So we've talked about this. And again, risk factors for the diabetes is just similar to the hypertension. Obesity. And physical inactivity also. Exercise. So you see that the inactivity, exercise, you can easily end up with hypertension, end up with diabetes. You can even end up with cholesterol, especially when you eat late at night, then you go and sleep immediately. So we advise that when you are eating, in fact, when we are eating, every food that we eat is broken down into sugar. So try to cut down on the sugar that you eat, because every food is broken down into sugar. Udi benkuni nkruma, morine wo benkuni will be broken down into sugar anyway. Nkruma will be broken down into sugar. So why do you now add extra sugar to what you are eating? That's what I say. And then when we are eating, so you see the carbohydrate contains more sugar than the vegetables. So we advise that you do a little of the carbohydrates, more of the vegetables, more of the soup, and moderation of the protein. That's how we should eat. Less of the carbohydrates or small of the carbohydrates, more of the vegetables, more of the stew that comes with it or the soup that comes with it, more fruits, moderation in the protein, but less of the carbohydrates. And so who can give me an example of a good diet to eat? So when him say we be a benkuno, 1 ball and so 2 balls na beso a mpacho benkune is carbohydrate. You need to reduce the size. It is you can decide to do more of the soup. Then fill it with more of the soup, and then 1 size of the banku. Yes. It's subjective. So you see, that's what I'm saying. That me, I don't like saying.
Size net to set them because
Okay.
we can one size near the boom. So we see a trade never problem. But me the train up boom. I have one size.
Oh, Debbie. So we are talking of an average size, like maybe at my fist and half. My fist and half. It's 1 size of banku. That's quite big, right? And so you see, and the truth is that as you are aging or as you are growing or as you are being more conscious of your diet, you would realize that with time, you will consciously be cutting down on the size you are eating. So that's how come I don't even like giving sizes. My principle is that let your tomorrow always be better than your today. In the sense that if you are looking at reducing the size of the food you are eating, today you are eating 2 balls, no problem. But tomorrow, make sure that you do not eat the same 2 balls. It should be lesser than what you took yesterday. Until now, you realize that, do you get it? So to balance that, you do more vegetables or you do more of the soup. In Tiesana, you can decide if you are eating banku and tilapia with pepper. You can decide to have soup on the side. Do you get it? You drink the soup, it fills your stomach a bit. Then you add your small banku and then your fish. You add more vegetables, so you have a lot of green pepper cut, onions cut, tomatoes cut. But who said that we control stress and we don't know what you are talking about? Is there? We are almost time up. 7 minutes. Hey, I'm told I have just 7 minutes more. Okay, somebody wanted to say something, so we continue. Somebody was saying something, yeah.
As you've touched on food, in terms of fruits, do you have the best way of eating fruits? As eating fruits and then taking your whole meal, which is, are you taking fruits first before the meal or meal and then?
Okay, all right. So, ideally, you see, it depends on the time you are taking your fruits. But if you decide that you are taking your fruits in the mornings, you can decide, depending on the type of fruit you are taking. Now, because the stomach produces a lot of acid or produces acid, we try to cut down. If you haven't eaten yet, you try to cut down on the foods that are rich in citric acid, like oranges, pineapple. You try to cut down on those. So you can decide to go in for fruits that do not have the citric acid in them if you are eating your fruit on an empty stomach. Example, banana, watermelon, apple. Which other fruits do we have? Pawpaw. All these can be eaten on empty stomach. But if the fruit contains a lot of citric acid, like orange, it's advisable not to eat it on an empty stomach. The reason being that once the citric acid is introduced into the stomach, it stimulates the stomach to produce more acid. And more acid on the empty stomach erodes the stomach wall, and you can end up with stomach ulcer. Have I answered your question? Yeah, go ahead.
I noticed something. I liked banana, but I don't eat it 1, 2. I take it as if I'm eating ambesi with granules. But at a point in time, I noticed that when I take that at night, I get mazupu. at a part, so I observe it severally, and then I decided that no, I will go away from that. And I was seeing what.
So every person is different. People have different ways of reacting to different things. I can stand here and tell you beans is very good. Good protein, plant protein is very good. But there are people when they eat beans, they end up with a lot of gas, a lot of bloatedness. Some would have a lot of belching. Some even end up with gouty arthritis. People are different. I've never heard of somebody complaining about banana causing muscle pull, but you have noticed it in you. So I said that once you notice a problem with something you are eating, just get off it. Do you get it? And again, like I was saying, you are saying you are eating the kweduno like you are eating ampesi. Moderation. Remember I said that. Let's have moderation in mind when we are eating. It may be your best meal. Because it's your best meal, you'll be eating it often. So remember to reduce the quantity. Moderation. If you decide to do like 3 or 4 fingers a day, that's fine. Because you're going to eat it again tomorrow anyway. So let's keep it down. Moderation. That's it. I don't think the healthy lifestyle is changing. Just have moderation in mind. Okay.
My sister.
My brother.
I'm an epileptic patient. I'm
You
an
are what?
epileptic patient. Epileptic
Okay,
patient.
sure. All right.
And the doctor told me not to be taking in granules. What will it cost me when I don't take the granules?
With your
Granules. Because I like granule soup so much.
So I must say, do you know, sometimes I come across people telling me all sorts of things that their doctors have said, and sometimes I'm amazed. I am really amazed. There are times when somebody will say that, oh, yes, menya typhoid, inti mami nko eja ho bebre. I've heard that before. Somebody will say that, yes, me was stomach ulcer, inti mami ndi mori adriane. I mean, sometimes the correlation is just not there. I wonder where all these things are coming from. I must say that nuts, on the whole, nuts contain unsaturated fats, which is very good. We prefer unsaturated fats to mono or polysaturated fats. So peanuts, groundnuts, pecans, almonds, these are all very good. But if you are an individual, you eat groundnuts and you notice that when I eat groundnuts, I end up, you see, my dad has gout. And we all know that gout is when you eat protein-rich diets. It's sickness for the rich people. That's what it said. But one day we were there, he ate granuts, he ended up with gout arthritis. I don't know if you get what I mean. Our body composition is all different. I don't know. So sometimes when you go and your doctor says, don't do this, ask. Doctor, is there a reason why I shouldn't take the granuts? Because I see no correlation between granuts and epilepsy. No. Not even one. In fact, not even a dot. No. Do you get it? So unless it's because of something else. Let me add this to our health. Now, doctors are supposed to be your friends. Doctors are supposed to be people you can open up to. I went somewhere, I was giving a talk. When I said, oh, you should be able to open up to your doctor, I was saying, doctors don't call me anymore. I understand. Sometimes the work can be so overwhelming, but you should be able to ask questions. And sometimes the way you ask the question also matters. Or challenging. That's when maybe they may be taken aback. But it is good to always ask why the doctor says you should do this. And I must add, if you are on medications, whether you are literate or not, try to know the name of the medication you are on and the dose. Sometimes you go to the hospital, there's a mistake at the pharmacy and you are given wrong drugs. You go home because you don't know the name of the medication you are even supposed to take. You go home with the wrong drugs, you go and take the wrong medication. Yes, sir.
From now onwards, write a bit clearly. Me, I don't know whether it's part of the training that
That's
they
a question I've gotten so many times.
because unless you are part of them, you can never see. And so if we can't see what you have written, How can we even know when they give us wrong medicine?
Okay, let me answer that.
And
So
then
when you see when your doctor
listen,
says that, okay, so I've given you medication, go to the pharmacy and take it. You ask your doctor, please, what medications are you giving me? Ask. Because sometimes you are allergic to Cipro. The doctor didn't ask you. And the medication he's written for you is actually Cipro. Then you can tell him, oh, I'm allergic to Cipro. He will change it. So ask the doctor, what medicines am I going for? That's number one. Number two, again, once you have heard the doctor is saying you are going in for Cipro, when you get to the pharmacy and they give you the medication, take it and look at it. Is this Cipro that has been given to me? It's very important. Another one, yes, then the handwriting thing. The handwriting is not part of the curriculum. When I sit and write for you right now, some people, I have so many people who ask me, hey, what now your first doctor, what should I do? I write very well, but you see, when during a teaching program, the course, you need, I remember when I started medical school, the first 2 days, my notebook, it was halfway done. We write a lot. So if you are not going to do handwriting, or you're cursive, and not your catch, number page 10, or no more than page 105. So to adapt to the system, you begin to write very fast. There are days when I go to work, in the mornings when I'm seeing less patients, I write clearly. But later in the day, as patients, so the handwriting begins to change. So it's not deliberate. Baby, so even when they have less patients, they still write like that. But it's not part of the curriculum. Okay.
So, doctor, please, I want to ask, like within 3 months, I went to the hospital. The doctor diagnosed that you have high BP. You have to check it like within 1 month or something for him to know what is going on. You go another time, it's low, and sometimes it's normal. It's continue like that. One doctor will tell you they will put you on the BP drugs. Another person will tell you it's too early for you to take it, so stop taking it, and it keeps on like that, on and off. So in that case, what am I supposed to do?
That's a very good question. So BP is never stable, okay? It always changes, it fluctuates. That's how come when you come to the hospital and they check immediately and they realize that your blood pressure is a bit high. Now, if I say a bit high, like I've said, 140/90 and above is high. If you come and immediately I check and it's 140/90, immediately I won't say you are hypertensive because so many factors can come into play. So then the doctor will ask you, they will begin to advise, try to cut down on your salt intake, try to do exercises, try to do this. And then when you go home, they will start you on medication. When you go home, keep a BP profile. How many of you have heard BP profile before? BP profile is you have a paper. You write your BP readings on. Sometimes they'll say first thing in the morning when you wake up, last thing you do when you go to bed. Write the readings down over a period of 1 week or 2 weeks. Bring it and let's see. That gives us a more clearer picture of what your BP readings are. So when you come and we notice that, your readings are high, even when you are not here, at home it's high, then we can now consider starting you on medication. You'd realize, but if you come to the hospital and that day the reading is very, very high, like as high as 170, 120, that's severe hypertension. That one is not safe to let you go like that. So sometimes you can be detained, rest a bit. Do you understand? And then let it come down. If it doesn't come, immediately they will start you on something. But again, they will say, go and check whilst you started the medication, go and check your BP, write it down, and then bring it. When you bring it down, we'll look at the readings and see the patterns. Now, looking at the medication you are on, should you remain on it? If your blood pressure goes low at a point, you realize that the medication you are taking, may even reduce the dose, or they may take you off it. So it's not in a straight jacket or straight box like that. Depending on the parameters, how your readings are at home, that's what we look at. Yes.
Thank you very much.
Oh, okay.
So I want to still ask about the BP or the hypertension.
Okay.
Right? I want to know which is too low, which is too high, because sometimes when you check for older people and the pulse is low, they'll be like, so please, if you can enlighten us on it. Thank
All
you.
right. So the pulse is just the heart rate, so when the heart is beating, okay, it runs through the arteries, okay. So when you feel your hand, here, this upper part of your hand here, That's what we call the radial pulse. When you put your finger on it, you feel some pulsations. Okay. Now, the normal pulse is 60 to 90. That's normal. Normal pulse or normal heart rate is 60 to 90. Anything below 60 is low. Anything above 90 is high. And so many things can cause that. Sometimes if you have a heart problem, we call something atrial fibrillation. If you have a heart problem, you can end up with a very high pulse. Do you get it? If you are anemic, you don't have blood, your heart will try to compensate the fact that you do not have enough blood. So it will begin to pump very, very, very fast, beats very, very fast. You end up with a high pulse. So normal is 60 to 90. Anything outside this is abnormal. So you see your doctor and then we investigate why you have a high pulse or why you have a low pulse. And then the decision can be taken.
Yeah, Doc. My question.
Sorry, please, did I answer your question? Where is she? Are you answered? All right. Okay.
My question, I have to ask you in three so that you understand it well. I went to the hospital and the doctor said, I'm allergic to banana. And I say, banana is a fruit, so then I'm allergic to banana. So, okay, I was like, I'm doubting him. So I tried taking banana. But me di banana now I said, apo. I don't know if you know apo. I started to say egume. I stopped. And I took it again. Still, it came. But say me di cocoa, ripe plantain. Near air soft and so I react to it. So I don't know. Yeah.
Okay. But unya apo neba ekekao. Okay. So what it says is, yes, I won't be surprised. Like I said, obia composition, even though we are all human beings, our composition is different. Obi wo ho me take seafood, but shenya me obi wo ho take seafood pe. She will end up with an allergic reaction. Now, how you know that it's an allergic reaction is the fact that after eating it, what you as apo, it's actually called urticaria. Urticaria. Yeah. Sometimes Ubon said na aya apo sano. Sometimes it can be even increasing in size. It will even be around your lips. Sometimes it's on your whole body. You get it? So yes, it's a sign that you're actually allergic to banana. You are. Once you're having that sign, and you've done it about 3 times and you are always experiencing, you are allergic to it. That's why I said that if something doesn't work for you, what do? Stop it. In that case, sometimes if it's a mild reaction, immediately if you have cetirizine with you, cetirizine is an anti-allergic medication. If you have it with you, it helps, goes down. But if it is generalized, you see that you need to go to the hospital to have an injection of hydrocortisone or a steroid. Do you get it? Last 2 questions. Okay, I hear we have run out of time.
Doc.
Yes.
I've been a chubby baby since birth.
You've been what?
A chubby baby.
Okay.
Since birth. Have I changed or not?
I don't think you've changed.
Okay, so you were talking about obesity. Member 70 now, but I make sure I'm what I'm supposed to eat. How can I control it?
All right. So you see, there are things we call, like when I talked about the hypertension, I said if you have a family history, you are also at risk. So we are looking at your genetic composition. Now, your family members, are you mostly like this? Or is just you? You are mostly like that. So it runs in the family. And again, I'm not just saying, if I say obesity, we are looking at your BMI. Have you checked your BMI? What is it? No, BMI can't be more than 80. Not your weight, oh. Weight is different from BMI. Really? Okay. All right. Okay. All right. Okay. So you'd realize that, so like I said, if you check your BMI and you are on the high side. Okay, BMI is your weight over your height squared. That's the body mass index. So you can check. Usually, if you are less than, I think less than 16 to 18, that's underweight. 18 to 20 or 22 is normal. 24 and above, you are about overweight. Then some greater than 28 is obese. So I'm not sure. In any case, all right, you'd realize that there are some people, they may look a bit big on the side. But when you check their, you do a cholesterol test, they are okay. Yeah, yes, slim, check your cholesterol, yeah, was so it's a lot of things you put in place. And again, like I said, once you have your lifestyle modified, you are following your regime, regular exercises, like you said, you are also controlling your diet, you should be fine. And if it runs in the family, there's nothing much you can do about it. If it runs in the family, just make sure that you are trying. I mean, if it's oily foods, you are not going in for oily, you are doing the cooked foods, eating in moderation. Once you are doing all that, I mean, you are fine. Okay.
I'm a doctor. I'm a person that can say the body, our body. Se bribia nya opa nankasa woni da. Yere kenya uni se. Wankasa wuni nyade awuti da bia. When you take it, pay attention to your body. Your body reacts. Babies, eto da bia, wo baby. Wo be man aduan kokra. Wo man. Kopim anwumre. Or react pepe so we should be thinking about this, listening to our bodies. My old man, very old, literate, tend to call it trying to diagnose. What they drew, no better 4, 5, more they are big. And I took a clue from what he did. What about pet? Yes, from Dr. Slim Tamara, from I'm going to take this 3 times in a day. So you leave it. 3, no, I teach you. No, I teach you. 8. Don't know. First one, 30 minutes. Oh, yeah, sure, sir. Those same drugs, but in 30 minutes apart. Doctor, no, no, I tell you, this particular drug gives me palpitation. So be honest, how did you know? That is why I told you that leave it. Now I'll tell you what is wrong. So when we are giving drugs or we are eating new food, pay attention to our body. And that alone.
Yeah. That's very, very true. I think we should put our hands together for him. All right. So when God created us, he himself put certain mechanisms in place. Like you saw when you ate the banana, immediately you reacted to it. That should give you a cue that this is not good for you. And then that's your body telling you, I don't like this. I don't accept this. That's exactly what he said. And paying attention to what we eat and our body's reaction is very, very important. Yes, I've had patients come to me that when I take this particular medication, I react this way. I end up with palpitation. That's very true. So it takes somebody who is very sensitive and very observant to notice such a thing. Yeah, that's a good point.
Dr. Mdase, made a contribution.
Okay.
I think we're supposed to be our own doctors. Doctor Nwako school was they also make mistakes. Because I quite remember there's one day, I also work in the hospital.
Okay.
There's one day, we call for drug, what do you him? What did you do? And this no the man. Until say, okay, say, medical gumi minimum, and sana, pharmacist and realize, think one can, or use now I'm on the problem. Until we should also read a lot. That's the reason why in a school, be a lawyer, try and get close to that person. One minute that in your way to be someone who are done a doctor, nurse, which is my cogia drew in a scene. Main fairness and my fairness, so don't be my advice. So, I never be wow. Secondly, at times when you go to the emergency, you see most of the BB patients, what need be fear by no way. Based on say be and the baby yard and the machine, what need you are not off. Into you say will be try possible best say. Give room say in never sorry be to mercy. It's here men fast are shocking news no. Men real because over Kwajaoma. Now things in Niama MY. So as people are not using Yɛmfa wei nka no yɛmfa mmɔ yɛn bra. That's
So let's put our hands together for him also. And then to add to that, Yanfan said we will be at Uko Hospital or Kolebu, and a very far place. Now, in times of emergency, don't insist, Mufaminko Kolebuna, Mufaminko Kolebuna. The distance, anything can happen within that time. So in emergencies, it's good to go to just a nearby facility. Let them assess you, intervene where possible. Then now later, you can ask to be sent to wherever you want to go. Because many people have lost their lives in trying to, so many things can happen. Sometimes, let's say, even hypoglycemia, sugar is so low. Common sugar could have been given to you at the hospital to save your life. But in the name of on the way, you can just lose your life. All right.
Yeah. Good evening. Please, I want to find out. Say, Obi akoma born tentem. Does it mean say nipa no? Meanwhile, like nipa no involved into any activity, any form of activity. But nakoma born tentem. Is it normal or is a form of maybe a sign of any?
Okay. It's abnormal. It's abnormal. Now, every normal person, when you are sitting there or you are not doing any activity, you shouldn't be aware of your heartbeat. You shouldn't. As for now, wakuma airboard, do you realize that wakuma aboard airby? That's the normal thing. You shouldn't be aware. But once you begin to feel your heartbeat, that's what we call palpitation. So many things can cause that. Like I said, hypertension can cause that. Unimoja, anemia can cause that. So many things. Heart diseases, heart failure, atrial fibrillation, so many things can cause it. So many things. So it's not normal. You need to be investigated. Okay.
And the person doesn't get what she wants, is it a problem? Or because sometimes the men tends to think that we are lying. Meanwhile, when you are pregnant, you even do things that on your normal human being you won't do. So I want to ask that those things, like, is it normal?
All right. So, like you said, I mean, it's just hormones that are causing such cravings, hormones that are exaggerating your emotions, hormones that will make you react differently from how you would have reacted normally. So, in a room where the temperature is normal, only you may be sweating. That's a normal physiological change that has happened. It's a normal thing in pregnancy. And once you give birth, the placenta is out, baby is out, everything goes back to normal. So I remember when I was pregnant, I used to have a lot of saliva accumulation in my mouth. And you are always working with a container. It could be so bad. It happened every morning you wake up with it. Every morning you wake up with it. Then it was when I delivered, the next morning I realized that, hey, my mouth is dry. That's how it just vanished. Because the baby is now out, the placenta is out. So this is just an interim. It's a temporal thing. Do you get it? How long? 9 months, it's over. The man should be a bit considerate. If she's craving for something, whatever, give it to her. After all, what? Give it to her. It's just for 9 months. After 9 months, it's over. If she's reacting in an extreme way, make excuses for her. After all, I put her in this situation. I put her into this condition. After 9 months, it will be over. So it's a normal physiological change. It's normal. Yes. They should have mercy on you. Did you have mercy on them? You were exercising. Exercising on who? All right. Okay, thank you very much. Thank you for having me.
Let's give it to her. She has really blessed us on some good health tips. Nyamin Shroud, Dr. Tamara, Nyamin Shroud pa. Abushan for miracle enti yabeje ya fore. Emmanuel Mistress bedi enim na ohye se wa ha yesrem momwa ye na